Bhakti, what took so long to a lot of people? Granted, there's people that are not so much anti-science, but look, prove to me it's right. I get that. But to the pro-vaccine crew, all of this should have happened 12 months ago, 15 months ago. Why did it take so long?
I think politics and misinformation, quite simply. We politicized the vaccine debate. We provided misinformation. And like the public was confused as to what is the right choice here. And there was no choice. Vaccines save lives. Everybody should take them.
We didn't have this debate with MMR. I remember some tension. I'll go with that a little bit, but nothing like now. Is it because of culture wars? Is it because of social media? Why did we do this?
I think it is due to social media, right? There's a lot of information out there. People don't really know where to look. On top of that, we mediacize, publicize. Every decision is being political, which leads to more noise. And with MMR, it was very simple. MMR is a vaccine. The vaccine prevents illness. Take the vaccine. That was all that was there. Now people, the modern consumer is looking at, how was this vaccine developed? How was the approval? How does this approval compare? What is this technology? I don't think half of us knew what an mRNA vaccine meant, and now all of us are well versed.
We're no longer talking about getting to herd immunity, Dr. Hansoti. We're talking about getting to a time when we see many fewer hospitalizations and many fewer deaths. And yet over in the United Kingdom, we are seeing the number of hospitalizations and deaths pick back up despite a very high level of vaccination. What's the latest school of thought in terms of the threshold of total population inoculated to get to that place where we really don't see this as such a present concern on a day-to-day basis?
The challenge with this concept of herd immunity is that it's a zero-sum game, right? That we get everybody vaccinated and the virus goes away. The truth is that the virus continues to evolve. We still get through breakthrough cases, and we have a greater proportion of our population who is immunosuppressed for one reason or another. In the UK, we really believe that this new peak is being driven by the lack of vaccination in children aged 12 to 15, and the school-going children are getting exposed and then bringing that virus home.
All right, so what's the latest on getting those individuals vaccinated? We have heard from the Pfizer CEO, they're ready to go. The FDA has basically all but approved this, so what are we waiting for?
October 26th is the magical date for the FDA advisory board. I think it will get approved. The CDC study already shows that it was 93% effective at getting children, keeping children out of hospitals, which is phenomenal. So I think there's lots of parents who are excited about this. I think the FDA will approve, and I think it's imminent. And pediatricians' offices are already missed of the flu vaccine campaigns. A rollout will be easy.
On a log chart, are deaths correlated with cases? We've got good news on cases. Bhakti, do you see a slope that is good news for deaths in America?
Yeah, I do, actually. I see that the deaths are actually teetering off. However, one of the challenges that we're now seeing in the health system is this lack of a workforce. So we're seeing severe nursing shortage crises around the country. And we are worried at what that does to individuals, not only those who are hospitalized due to COVID, but are hospitalized due to other medical conditions. So yes, there's a human resource crisis that's happening as well, which is complicating this picture, but we do see a decrease in deaths.